Too often, when people think about charity, they picture donation receipts and a single glaring question: how much goes to overhead? That question comes wrapped in a myth, the idea that the lower an organization's administrative or fundraising costs, the more effective and deserving it is. Today, we start by debunking that myth and reframing the conversation around what really matters: outcomes, sustainability, and ethical investment in long-term change. First, let's define the overhead myth. It's the belief that overhead, salaries, administration, training, monitoring and evaluation, technology, and fundraising, is waste. In truth, overhead covers the essential infrastructure that allows a nonprofit to do its work well. Those expenses pay for skilled staff who design effective programs, for monitoring systems that measure impact, and for partnerships that scale solutions. Without them, even the most well-intentioned charity can deliver temporary fixes that come undone once goodwill dries up. Why this matters? Obsessing over a tiny overhead percentage incentivizes short-term thinking. It rewards organizations that cut corners on planning, M&E, and staff development to keep reported overhead low, even when those cuts weaken programs. Conversely, investing in strong administration and learning leads to smarter interventions, better stewardship of donor funds, and programs that address root causes rather than just symptoms. Consider two real-world examples. 1. A community health program that invests in training local nurses and a data system to track immunizations, overhead that reduces disease and prevents costly outbreaks. 2. A conservation NGO that spends on scientific staff and long-term land management plans, stopping habitat loss rather than paying for repeated emergency rescues. Both show overhead as a multiplier, not a drain. Many experts, philanthropic advisors, development economists, and experienced NGO leaders echo this view. Transparency about spending and clear impact reporting are more revealing than a single ratio. That said, challenges remain. Donors may lack reliable information to assess impact, or face emotional appeals that favor immediate relief. Some organizations may still misuse funds, so vigilance and accountability are necessary. In the end, we must connect this discussion to a broader ethic, supporting organizations that balance operational investment with measurable impact. Reframing the overhead conversation encourages donations that build capacity, foster resilience, and create sustainable change, not just Band-Aids. When people talk about overhead in nonprofits, they usually picture flashy executive offices or big administrative budgets, but that's a narrow, misleading view. Overhead is simply the money an organization spends to operate. Staff who plan programs, specialists who monitor outcomes, systems that track donations, rent for safe workspaces, legal and accounting services, training, evaluation, and the technology that keeps everything running. These are not optional frills. They are the infrastructure that turns good intentions into reliable, measurable impact. Understanding this shifts the conversation from a single percentage to purpose. Investing in finance, human resources, monitoring and evaluation, and communications makes programs scalable and sustainable. For example, a health nonprofit that spends on a strong data system can track which interventions reduce child mortality and then expand the ones that work, rather than repeating ineffective actions. A social enterprise that invests in staff training will deliver higher quality services, retain skilled employees, and reduce costs tied to turnover, all of which improve long-term outcomes. Concrete examples clarify the point. First, a clean water organization that allocates funds to local technician training is not padding overhead. It builds local capacity so wells stay functional years after installation. Second, an education nonprofit that budgets for curriculum development and evaluation may spend less on direct classroom hours initially, but its students achieve better literacy gains over time because the curriculum is evidence-based and continuously improved. Experts increasingly agree that low overhead ratios are not the sole indicator of effectiveness. Evaluators and philanthropists argue that outcomes matter more than a fixed administrative percentage. A challenge here is public perception. Donors are conditioned to favor low overhead and may be wary when nonprofits seek funds for operations. Transparency and communication are essential. Organizations must explain how operational investments translate into outcomes, showing, for instance, how monitoring reduced program waste or how training lowered service delivery costs while improving quality. This understanding connects to broader nonprofit topics like fundraising strategy, impact measurement, and ethical grant-making. Moving beyond the overhead myth encourages funders to support full cost recovery and helps nonprofits plan for durability rather than short-term fixes. When everyone recognizes that smart overhead leads to sustainable change, giving and grant-making become tools for lasting transformation instead of temporary band-aids. When we talk about charity, many people picture volunteers handing out meals or delivering supplies. Important, immediate help. But sustainable change comes from something less visible: investment in capacity and infrastructure. Capacity means the staff, systems, training, and technology that allow a nonprofit to plan, measure, and scale its impact. Infrastructure is the backbone: offices, data systems, supply chains, legal and financial processes. Together, they turn good intentions into reliable, lasting results. This matters because short-term aid treats symptoms. Capacity investment treats causes. A well-trained caseworker can guide families into stable housing, rather than just giving a temporary hotel voucher. A robust monitoring system lets an organization see which education programs actually improve literacy, allowing it to focus resources where they work. In effect, spending on capacity multiplies the effectiveness of every dollar donated. Consider two concrete examples. First, a nonprofit focused on clean water could spend the same money on buying water purification tablets each month, or on training local technicians and building maintenance systems for pumps and pipes. The latter requires upfront infrastructure spending, but results in functioning water systems that serve communities for years. Second, an organization working on job training may invest in a learning management platform and staff development so their curriculum can be adapted, scaled, and rigorously evaluated. That investment yields better employment outcomes and reduces repeated program costs. Experts and donors increasingly support this approach. Philanthropists and evaluators stress that overhead is not waste. It's the investment that makes programs accountable and effective. Leading voices in the sector argue that low overhead percentages can be a red flag. Operations starved of resources struggle to measure impact, comply with regulations, or protect beneficiaries' data. Challenges and misconceptions remain. Donors may fear their gift won't feel tangible if it pays for office rent or dashboards. Some organizations have misused administrative funds in the past, creating skepticism. These concerns are valid, but the alternative, underfunded infrastructure, leads to program failure, burnout, and wasted aid. Capacity investments connect directly to other aspects of nonprofit work: fundraising, program design, evaluation, and governance. When donors understand this link, They enable organizations to build systems that deliver lasting change rather than temporary fixes. Ultimately, investing in the backbone of nonprofits is not spending on overhead, it's investing in impact. When people talk about nonprofit efficiency, they often reduce complex work to a single number, the percentage spent on overhead. But measuring impact by administrative ratios alone is a myth that can steer organizations towards short-term optics instead of long-term change. Administrative costs, staff, evaluation, finance, compliance, are not inherently wasteful. They are the infrastructure that allows an organization to design effective programs, learn what works, and scale solutions responsibly. Measuring impact means prioritizing outcomes over simplistic expense splits. Outcomes-based measurement focuses on the changes an organization produces, improvements in health, education, income, or environmental restoration. It asks questions like, did child immunization rates increase? Are farmers earning higher yields after training? Did a shelter reduce repeat homelessness? These are concrete indicators of progress. Investing in monitoring and evaluation, skilled staff, data systems, and learning loops costs money up front, but it creates evidence that lets nonprofits refine programs, stop ineffective interventions, and multiply what succeeds. Consider a community health nonprofit that spends 12% on monitoring and evaluation. That overhead enables a randomized trial showing that door-to-door counseling boosts vaccine uptake by 40%. With those results, the program can be improved, funded by governments, and scaled to reach 10 times more families. Or take an education nonprofit that invests in teacher training and curriculum development, higher salary costs, but measurable gains in literacy scores. Those improved outcomes translate into long-term benefits for children, not just ticketed outputs like meals served. Critics argue donors want low overhead because it supposedly signals fiscal restraint. But insisting on minimal administrative spending can force organizations to underinvest in planning and accountability, producing short-lived Band-Aid services. The alternative view, supported by funders focused on evidence and sustainability, prioritizes cost-effectiveness per outcome. This shifts the conversation from how much is spent on overhead to what each dollar accomplishes. Measuring impact also connects to other vital practices: transparency, stakeholder engagement, and adaptive management. Clear reporting on outcomes and the role administrative functions play in achieving them builds donor trust more than arbitrary ratio benchmarks. Ethical nonprofits therefore frame budgets around goals and metrics, explain trade-offs, and show how investments in capacity lead to durable change. In short, focusing on outcomes over ratios helps donors and organizations move beyond myths toward measurable, sustainable impact.